As I walk into the room to see the patient, the most striking thing that I notice is
Alright, welcome to the channel. Oh my god, what is that? That's like some like fish lips.
I'm Adam, and this is Regan.
We're just
My lips
commentating
don't
on
normally look like this.
the patient is speaking full sentences to me, but she had what's called stridor, which is this inspiratory sound every time she took a breath.
I think it's a shellfish allergy.
Right.
Oh my god.
Why do we think that?
Well, we went out for dinner, and she had
We
some
just
shrimp,
put a suction
and
cup
her
on her
lips
lips.
started to swell, so we went to the clinic. They gave her something for it, but it didn't get better.
All right, let me take a listen to you. I'm gonna have you
Oh my
take a
God.
couple deep breaths.
I've
Is
seen
she
fish
gonna be okay?
with
There was
better
absolutely
looking
no swelling.
lips.
Yeah, she'll be fine. Let me just take a good look at her here. Just take a listen to your back.
If you're new to the channel, subscribe and
Just some deep breaths.
turn post notifications on it to see daily
All right,
uploads.
good.
I try to do
So I'd like you
daily
just to lay
uploads, but I have a
back,
big
try to
schedule.
relax, take some deep breaths.
But
And I don't
we
see
do weird
any
stuff like
rash
this,
or hives
just
or
reacting
anything.
to weird stuff and just commenting.
I'm gonna get you some medications very
weird stuff
similar
like
to
this.
what you received over at the clinic, only IV. They'll be much stronger.
Thank you.
So I went on to see another patient. My objective was to go back and check on her in a little bit. Then all of a sudden,
Doctor, she can't stop coughing.
Regan?
I feel bad for the person,
Doc, roaches stats are down to
but
88%.
the lips.
Okay.
I
Why don't you
can't
drop
go
some
back
epi,
to this.
0.3 cc's of 1 to 1,000. The fact that the patient improved externally but didn't improve with her breathing pattern created a
Her
real
lips are
mystery
down.
for me. Let's take some deep, slow
Yeah,
breaths.
no, I
You know, so
like her
really,
lips.
at this point, I'm trying to, rack my brain as to what else this could potentially be.
I can't breathe.
Epinephrine is a medication that
Like,
we'll
trying to,
use when somebody is
make
in
fun of her,
severe allergic reaction or
with those lips.
anaphylactic shock.
You can't help
All right,
but
Regan,
laugh.
little
but
pinch, okay?
It's always
It's a medication that we don't take lightly. It's a big gun medication, but in her situation, she really needed it.
Stats are still dropping.
What does that mean?
It means that not enough oxygen is getting within her bloodstream. Kathy, will you get a non-rebreather, please? So after the epinephrine was given, her heart rate increased, which could just be from the medications, but the key to this is that her oxygen levels were decreasing. And at that point, I really had to think, what else is going on? This just wasn't adding up. We may have to intubate.
Intubate. That's like a tube down her throat.
That's right. This situation has escalated to the point that I am very concerned.
I have
Regan,
really bad
we're gonna have to hook you up to a
choking
ventilator to breathe
reflexes.
for you, okay? It's getting to the
Something
point that
goes
this is
down
gonna be
my throat and I don't
necessary.
like it.
Is she gonna be unconscious?
Pop
Like in a
out.
coma?
She'll be sedated, but not in a coma. I start to see some abnormal twitching in her hand,
Regan?
and the patient started seizing right in front of my eyes. ET tube? And I could see the vocal cords perfectly. I passed the endotracheal tube, and a couple centimeters past the cords, dang, I just hit this brick wall. I couldn't advance it any further. Some obstruction. I can't pass the tube. I mean, I was really at a loss as to what could be causing this. Suction? Can you get the fiber optic scope, please?
Roaches stats are still 86%.
I again considered the possibility that maybe she aspirated something. I considered the possibility potentially of some sort of mass beyond that point. A couple things in our profession really make us nervous, and a bad airway is just one of those
That's very
things.
scary.
Roaches stats are 84%.
Never want to show it on the outside, but inside I'm feeling nervous. If I cannot intubate this patient, she's going to die. I mean, there's no cord edema at all.
What is it then?
It's got to be obstruction on the other side of the vocal cords.
OSHA stats are down to 78%.
Can you give me a cric kit, please? At this point in time, because I cannot intubate her, her oxygen levels have dropped. I mean, this patient is critical. The next step at this point is to do a surgical airway. All right, I'll be right back. It's called a cricothyroidotomy. We make an incision, and within the neck, we insert the endotracheal tube that way. This is a procedure that we don't perform often, and I need all hands on deck. Oh, wow.
What is it?
There's a mass here, right where I need to cut for the cric. So if I cut into this mass, she could bleed to death. However, if I don't attempt to get an airway, she's going to basically suffocate to death.
What do we do then?
I don't know. Yeah, we're going to have to do a retrograde intubation.
What is that?
That's where I put a needle into her neck. I put a guide wire through the needle up to her mouth, and I put a breathing tube over the wire. I'm still making a small puncture wound with the needle, but it's not a large incision, so the risk of bleeding is much less. What I don't mention to the boyfriend is that I've never done this procedure on a live person. I've only done it on a mannequin during medical school. Their oxygen level kept dropping. By performing the retrograde intubation, the wire is passed through the mouth, and what I did was I hooked a very small pediatric endotracheal tube onto that wire, thinking that I may be able to pass this smaller tube through the trachea. Bagger? All right, let's get x-ray in here. So now we have a pediatric endotracheal tube in the patient. The real question, is it enough to deliver enough oxygen to this patient to prevent hypoxia and even death? Normally, I would expect to see an endotracheal tube that takes a nice straight path into the lungs. In this case, the tube actually took a very tortuous path around this mass into the lungs. She had come in with a swollen lip. She obviously had an allergic reaction. I think that allergic reaction was enough to set this mass off to that critical point that it obstructed her airway.
O2 sats 83%.
Keep bagging. The oxygen levels aren't coming up the way I would expect them to. Keep bagging, come on. And at this point in my mind, I'm thinking, are we too late? Come on, Regan. She is on the ventilator. Her oxygen levels are increasing. However, she is hanging on by a thread. At this point, I was convinced that she had a tumor. So I decided I'm going to call a specialist in. I'm concerned about this mass. I'm thinking that they're going to want to biopsy it. I'm worried about malignancy.
Cancer, you mean?
Yeah. I arranged for her to have a CAT scan so we could more clearly define what this mass is. But then also I'm trying to contact an oncologist. They're the expert in this field, and I want to get their opinion.
Wow, how did you do that intubation?
Yeah, holding my breath the entire time. Tell you the truth, I think that tube's moved a little bit since we did the x-ray. My concern was that this was growing by the hour and we were really working against time.
Well, we'll get a biopsy, but it's a lymphoma. I can tell you that right now. I better start making calls. Now.
There are very few indications for...
Don't subscribe to TLC. Subscribe to me. Alright? I'll see you on the next video.